at a sitting. I'll take maybe 8 o'clock, and then maybe 10 o'clock I'll take the other one, and then maybe 12. That's still 3 times a day. Yes. So, but then 3 times usually translates to every 8 hours for most medications. And then if it's 4 times, it's usually 6 hours every 6 hours. So I think patients need to be very conscious. Because of my work schedule. So then the pharmacist is able to advise the patient accordingly. Because of this, then I think it's best you take it at this time and then space it like that. Especially with anti-malarials. You know, some of the anti-malarials, you know, the first dose and the second dose are usually 8 hours apart, and then the subsequent dose are 12 hours apart. So some patients would be like, I don't think if I take it at this time, the 8 hours will probably be at dawn or midnight, and I'll be asleep, and I may not be able to take it. So then we figure out what time is best for you, so that the 8 hours would be at a time where you are available and you are not engaged in anything. Then you can take the medication and ultimately ensure that you get the best outcome, the best treatment outcome.
It happened to me recently, so that's why that's why I'm saying it. It happened to me recently. I went and got the medication. I went and got the medication, and then I discussed with the very kind gentleman at the counter that I am likely to forget if the medication requires that I take any of it at night because I won't remember. I mean, how do I wake up at 2 a.m. to take medicine? Like it's not functional for me. So we had to do a lot of back and forth to work out the timing for the medication. Yes, that was suitable. So do we encourage patients and people who are getting medications to sort of also open up and talk to the person who is dispensing the drug that you said I should take it with food, for instance? What kind of food are you talking about? Because people don't ask because probably mine is a cup of coffee, but somebody's thinking about fufu, so he's going to wait till he's eating the fufu before he takes the medicines. Should we have those conversations with the people who dispense our medications?
I think it's very important we have those conversations. And I mean, considering how sometimes the pharmacy gets busy and overwhelming, sometimes we are unable to take time and counsel our patients appropriately.
Sometimes, like, you guys are in a rush. It's like you go and collect the medicine.
I wouldn't want to blame.
You put it in the rubber and say, mature or so.
Some of the patients too are to be blamed. Let me share this story. There was a time at the community pharmacy, this patient walked in and then he wanted to get this medication. So I think it was an over-the-counter medicine, so I could just give it out. I gave the medication out and I was, labeling it so that I'll show the patient that, take it at this time and all of that before I package and hand over.
The patient
was like, "Mako school mini makenkai." Really? Come on, who does that?
Well, I don't know. I think that, you see, for people forget that the medications that we buy at the pharmacy, people forget that they can be poisonous.
True.
People forget.
Yes.
And sometimes they need to be reminded.
Yeah.
But sometimes it is, you know, the environment. There are some of the pharmacies, and it's not all of them.
Yeah.
Sometimes you go to some of the pharmacies and they have like a small room attached where someone could say, "Oh, could you please come and sit down so that we go through your medication?"
Yeah.
Sometimes you just go and just put it in your rubber and hand it to you, and then you walk out. So it happens.
Yeah, it does. I think usually where we put in a lot of efforts, where the patients have a lot of polypharmacy. So these chronic conditions, someone battling with diabetes, hypertension, and all the others, and then they have a lot of medications. Usually the pharmacist would want to insist on engaging them and, you know, counseling them appropriately on how to take their medicines. But usually if it's just these single medications, pills just for maybe a common cold or something, then they don't really pay much attention to that. But I think it's also important we have those conversations.
Okay, so we'll come to the one about patients who are taking multiple drugs in a moment. But I want us to focus a bit more on how we keep medicines safe at home. So let's start with the pediatric drugs, like the medications for kids. If someone is listening, they've bought medication for kids, how do I keep medicine safe at home?
I think it's very good you brought this up, because I mean, part of medication safety is also ensuring that medicines are kept in appropriate spaces. I mean, usually some conditions influence how the medicines will behave, or the chemical entity in the medicines will behave. So like humid environment, exposure to sunlight, and all of that. It will be surprising that some people, in an attempt to prevent or keep medications away from their kids, would want to store them probably in a locker in a bathroom or some other place, which is exposed to maybe water or some humid, you know, conditions. And all these things can affect the medicine. And I think it's very important that we store the medicines appropriately. Some medicines are preferably stored in the refrigerator, usually the suspensions and sometimes the suppositories. So being conscious of that, and all this information are available in the patient leaflet that I mentioned earlier.
Let's assume that everybody's like me and we are not reading the PIL. Yesterday I was trying to read one for a drug in the hospital, and the text is so small.
You cannot.
I cannot read it properly. So if I'm storing my medicines at home for kids, you're saying that I should keep it where?
In a cool, dry place.
In a cool, dry place.
Yes.
What is a cool, dry place? Okay, don't worry. Before you answer that, let me welcome Dr. Mrs. KOFUA ODEI NYARKO. I can't pronounce your first name. I don't want to butcher your first name. It's WYNETTE.
It's WYNETTE.
What happened to the simple name?
I think I would have to ask my parents.
WYNETTE, you're welcome.
Thank you, Doc.
All right. So, I mean, like you're just joining. Where should we keep the medications in the house? Like for the kids' medication. It's like the ones that are tasty.
I mean, usually all the kids' medications are
they try to make it tasty.
Yeah, like some of them are really tasty. So parents
the
are listening and they are wondering like because sometimes you want to hide it. That's the thing.
Yeah.
You want to hide the medicine, but where should we keep medicines at home so that they are safe for kids?
Okay, so just as my colleague was saying, with every medication they have the conditions under which it should be stored, and based on how the pharmacist, usually when we dispense medications, we tell you where to store it. But I think your question has two things in play here. How to keep it away from the kids. But in trying to keep it away from the kids, you would want to store it in the appropriate places. And most of the times when we dispense antibiotics, the suspensions to the patients, we try to tell the parents that when are you getting home? Because some parents want everything fast. We're in a very fast generation. So they'll be like, oh, kindly reconstitute it for me because I want to give the child some here and there. But then you ask them, when do you plan on getting home, or how far is your house from this particular premise? And you realize that it's an hour away. And usually once we reconstitute it, it needs to be kept at the right condition in the refrigerator. So first and foremost, if you are storing medication from your children, it should be in the right place. So ask your pharmacist, where should I store the medication? If it's supposed to be in the refrigerator, we'll let you know. If it's not supposed to be in the refrigerator too, we'll let you know. Some medications too, like you said, in a cool, dry place.
Cool, dry place, under my bed
and then we ask them, no. So when we say cool, dry place, we want a place that's not subjected to humidity or it's not subjected to moisture.
Talk to me. No. Talk to me like I don't know moisture, humidity.
So we want a place where water would not, because some people have lockers in their washrooms. Maybe the parents have washrooms where they know that, oh, my child would definitely not come here. But mind you, are bathing there every day. Once you are bathing, water is splashing everywhere. If you are using a heater too, it's going to get the place very humid. Do you understand? So if you can get a place that moisture isn't like a prime factor there, that'll be the best. So maybe the drawer in your bedroom, you just lock it. Make sure you lock it. I think we need to put the right measures. Tell your child, this is mommy and daddy's their place. You're not supposed to come here. Aside that, there are medications that we don't want you to we don't want you to subject it to sunlight because it can affect it or heat. So definitely don't go and keep it on the microwave because you know the child cannot reach there.
But that's where it's like
very
that's where
true.
It's far. So let me put the
so that they cannot access
so
it.
They cannot reach it.
But at the end of the day, ask yourself, me keeping from the child, I don't want the child to overdose because any day who say by the time you realize the reaction is happening, you may not even know it's a medication. But then again, ask yourself, baby, I'm day so medicine temperature affects it has changed. It's going to be harmful to the child. So bear in mind, high place, it could be the top of your wardrobe. Your child cannot access there, but on top of your microwave where you're always heating things, it will affect it. Inside the refrigerator, because you feel like, oh, freezer hold your own due because it will freeze it. Even though we are saying keep it in the fridge, it's not supposed to be frozen. So you should bear that in mind. Yes.
So when you say we should keep it in the fridge, you guys mean that we shouldn't freeze the medicine?
Don't freeze it, please.
Now, you see, because if you tell me that Fredoni koshe fridge me fridge mo kwan wo mo.
Yeah. Someone is using a
those deep freezer stuff. Yes.
and somebody has increased the thermostat to like 7 or 8.
Yeah.
So as soon as they put the medicine inside, a ice block So all those things are important.
Yes.
Yeah.
Very, very
a parent
important.
is asking me to ask the two of you that, what if she puts the child's medicine in the kitchen cabinets where she has her spices and everything, because that one is high, and she's she says that's where she stores her medicines, and now that she's listening to us, she's wondering whether she's been doing the right thing. So say baby like mekonini
those
spices they want how say how you dry like that's where she keeps her medicines.
Yeah.
Is that all right? That the cough mixture is smelling a little precocious.
Oh, if the cough mixture was smelling a little precocious, like it wouldn't have been an issue. But it's the kitchen that's personally I'm worried about, because you're always cooking there. Heat is a prime factor there, so it would definitely affect some medications that are heat sensitive. So I wouldn't recommend the kitchen. So yesterday, no new free kitchen, non baby for could be. I think the bedroom would be the best place as at now, because most parents don't allow their children access into their bedroom. So I think that would be the best place. But kitchen, bathrooms, those wouldn't be the best.
No, not under the bed too.
No. Under the bed, there may be heat there if you don't have AC in your room.
Okay, so you see all these things when it comes to medication safety, you know, it's so sometimes you give people medication and then they come back and like they haven't gotten better, or you look at the medication, you realize that that's a donor necessary. So when you're talking about reconstitution, if I want to mix the medicine, sometimes there are medicines that, and I'm starting with the kids, you know, like we buy the medicine, it's in powder.
Yeah.
What kind of water should I use to mix the medicine for it to be safe, Ben?
So usually when it comes to, they will say freshly boiled and cooled water. Yes. And I mean, it's purified, but then ideally, what the manufacturers would advise is freshly boiled and cooled water.
Freshly boiled and cooled water.
Yes.
I mean, this had I didn't with you.
So then we usually resort to the purified water, like the Voltic, the Verna, and all those things, because we are assured of the purity and all of that. But the whole idea is to, if there are any microbes in there, because water and moisture is usually a suitable environment for microbial growth. So freshly boiled, we eliminate the microbes or bring them down to zero before we mix it with the granules or the powder.
Oh, that's a tap water.
It's not really assured, because tap
now
water.
Pure water, so like if I buy water,
you know, this pure water,
you can't be sure.
You cannot be sure. Cannot be sure. There was a time I bought a pure water. Don't suffer more. There's this slimy and
a new variant. So if we are reconstituting the medicine, ideally I should buy clean boiled water, like clean, like
you can
bottled water.
If you're in your home, you can get if you use tap water, ideally I would recommend that you boil and then you let it cool before you mix.
Okay.
But if you don't have the time, usually the pharmacist would do that for you.
And as I don't know, check on. They do so many like skirmishes. That's what Charlie, time no day. Like that's what a lot of people do. But I see it. Me when I enter a pharmacy, I'm not a doctor. So I just go and stand there and fold my hands. And I was say, Adena, attendance near the person is just tired of all this. He has gone here, he's shaking the thing. So I want to go and do it at home. So when I, like there's a mark on it. When I pour the water in it, like, how should I shake it? Because sometimes I say did that last year.
So with the shaking too, you don't shake it aggressively or vigorously. You are not fighting with the bottle.
I didn't dissolve it.
I think all these shaking can also affect the drug molecules to some extent. So you usually want to shake it slowly this way, and eventually it will mix, because as you go back and forth, the motion would eventually cause the drug to be dissolved. So you don't have to be very aggressive about it.
I think the reason why most people end up shaking aggressively or vigorously is because before you mix the powder, you see the powder has been there for some time. So sometimes it coagulates at the bottom of the bottle. So when you add water to it, the upper part is what's mixing, but there is still powder part. So what we recommend is before you even add the water, tap the bottom of the bottle to make sure the powder becomes loose,
losing the granules.
Then before you introduce water, even with the water, you don't pour up to the mark first. You pour a little, reconstitute, then top up to the mark. That's what we usually recommend.
You see, my listeners, all these things are important. I've intentionally taken my time to talk about this because I see patients. Okay, I see patients, or I see people at the pharmacy. And then it's like they don't want the thing to be done for them, and they don't also want to listen to the instruction on how the thing should be done. So even if I'm going to pour, let's say, 20 mils of water in it, I should pour just small first,
about
and then mix it
before you top up.
Before I top up
to reach the
volume.
Yes.
And some of them don't have max. Some of them you have to add a specific volume. So there will be an instruction, maybe 50 ml. That's the thing. It comes down to the PIL.
So and listeners, this one is for you, and that's why I'm taking my time here, because if you have bought medication for kids, antibiotics usually that require reconstitution, you would know this. Yeah. That sometimes when you buy hospital, like there's only gene. At that point in time, Charlie, can I give the medicine to the child? Because I didn't know. But my I am like my hand I am. But say she na say me if you can say me for 1 spoon and be 2 spoons of milk. Can I go ahead and give it to the child?
I recommend you call your pharmacist, because first and foremost, you've added more than you should. So right now the volume is different. So if we told you to give 5 ml, that 5 ml might not contain the particular strength that we need for the particular effect. So should you come to your pharmacist, maybe they'll check the volume that you have right now and do the right calculation, so that maybe instead of 5 ml, we know that, oh, you added 20 ml instead of 10 ml. So maybe I'll make you top up the dose so that you can get the particular strength of medication that's going to bring the necessary or intended effect.
And then, like the next time that I'm giving the drug, do I have to shake it again, or?
Yes.
So that's one peculiar characteristics about suspension. Usually they settle once you leave the bottle to sit for a while. So every time you are going to administer a dose, you have to shake, not aggressively again, shake to reconstitute the powder, and then you can get the exact dose in the drug.
Okay, so Boachi sent me a text and he's saying that, you see, what we're talking about is important to him because he bought the medication yesterday. But it's in a long time. He's saying that after reconstituting the medication, he realized that the 7 days that they say you give the medicine,
it's not rich.
And so,
yeah.
Can he? Oh, you know, like say if I give 3 days now, then I'll
top up small.
So please talk to Mr. Boachi. Pastor to WYNETTE. Also, he wants to know that when the medication is finished in those suspensions, can you add small liquid to make it more? Exactly. So, like, I have given you said I should give the medicine for 7 days, but you people send the medicine now. You know that this bottle it
won't reach.
So right now he's done like 3 days, 4 days. Can I top up water back to the mark and give it?
You want to take this one?
Ideally, it should reach the 7 days, but I think we've had instances where people will come and be like, "Oh, doc, after reconstituting this, he said it was going to, it will be enough for 3 days, but it looks like it's finished in 2 days." Sometimes the question we ask is, did you top up with the right volume? Because I think with today's conversation, we're realizing that because, I mean, parents have a lot going on, they're in a rush and everything, so probably all checking, but you did not check, was it the right volume? If it's the right volume, then manufacturers have done it in such a way that it should definitely reach up to the right mark. But if it was not enough, I wouldn't recommend going by yourself without talking to your physician or your pharmacist in order to be, maybe a man is it 3 days, then so in 2 days. My main this local pharmacy, I mean, top up, so obviously 3 days. Yes, I wouldn't recommend doing that. I'd first recommend come and speak to your pharmacist, then they'll take the necessary steps.
So now it's not safe.
No, it wouldn't be safe because right now we also have AMR in play.
People are doing things.
Yes,
it's serious.
People are doing things. You see all the parents who are texting me low-key. I'll read all your messages.
They are all suspects.
I read all your messages. Relax. So that is for the reconstituted medications. Then now we have the medications that are already constituted, like paracetamol syrup and all those things. And no, the chef fridge man, paracetamol syrup, cough mixture, multivite. On said do not udisi hwana entach a person no channel. Should we put it in the fridge or we should just leave it on the counter?
So for those syrups, ideally it can be stored in the counter.
Okay.
Not necessarily in the fridge. The medications that we usually recommend we store in the fridge are the suspensions, the ones that we reconstitute.
Okay.
Because of the risk of microbial contamination, because it's water that we are introducing in there.
Okay.
Usually the syrups, they add some preservatives and other things to minimize the microbial contamination. So usually you can just leave it on the counter or anywhere that is cool and dry. Yes.
Okay. Now that's syrup that I have bought. The people who have kids, they listen to the show a lot and their questions make sense. That syrup that I have bought, I have 2 kids. Today Kweku is hot.
Yeah, tomorrow. Kwame is also
Next week Kwame is hot.
Yeah.
But they don't be a cow.
Yeah.
Send me to me the man.
Oh.
WYNETTE.
Funny enough, this explanation fits my mother perfectly because she had 5 children and she didn't have time to go and buy paracetamol. Maybe she'll go and buy Calpol for this one. Calpol is a very expensive. Then the next week, maybe Akia is sick. She has to use the same Calpol. But let's bear in mind, it's especially some medications with everyone and their system, everyone and the issues that they have. Let's say you buy ibuprofen for one child, or a doctor recommends ibuprofen for one child, and you give it to the child, they have the intended benefits. The next week, you see that, oh, Amma, my second daughter, probably has the same symptoms that Kwame showed a week prior. Am I going to give it to Amma? No, because Amma may have ulcer, and ibuprofen is an NSAID, or Amma may have a particular comorbidity, and I want say journal person de mano M1. And even before, maybe if you have it there, just come and talk to your pharmacist. I mean, I don't think pharmacists want so much money that if the same medication they'll give to you, like it can work, they'll tell the child.
And say you rush her don't
you have Billy must have paid. Oh no.
Me have stopped dressing well to that's good. But me share shows I'm t-shirt. My packing one chain home. I'm an anti because in conform no more boy doing the price. So the thing is that if I have given let's say the medication to one child and another one is exhibiting the same thing, I should not give the same medication. I have to go back to the hospital or the pharmacy.
Yes.
That's synonymous to self-medication.
That pastor must shop me and says you
No. I think she's not saying that you have to go and buy a different paracetamol, but let the pharmacist see the patient. Let the pharmacist know that this patient is also this child is also experiencing the same thing. We can investigate further to find out what exactly is wrong. So that we don't just give the medication, we're just chasing the wind. We don't know exactly what is wrong.
But how long like right now it's cool, right now it's raining. All these cough mixtures and paracetamol syrups, ibuprofen syrups and stuff. Like how long should it be there before I say okay, wait the mamin tonchene?
Okay. So I think usually the suspensions store at most 14 days.
Like 2 weeks.
Yes, 2 weeks. Usually, well, it depends on the volume and how long the therapy is. But for suspensions, usually beyond 14 days, it's the chances of getting bad is high. But then the syrups and all those other ones, I think up to a month.
Yeah, most of the time.
The multivitamins and all of that.
Okay.
Up to a month.
Good morning to you, Letitia. Letitia is saying that Letitia is saying that I gave my daughter some medication that I bought over the counter. The following couple of days I realized that there were ants around the bottle. Said I bought another one and the ants still came back. My issue is that should I still give the medication because it appears the medicine is sweet and the ants are attracted to it? Is the medication still safe? So, you see, some medications are sweet, and when you use so let's start from the cap or the syringe plungers that are in it. When I use it to give ABR, Calpol or paracetamol, can I use that same plunger to also go and draw the suspension and give? That's how
it's not safe.
No, you see, you want us to practicalize it.
Yeah.
So I should use a different plunger.
Yes.
That is hard to wash.
I think even with the ants scenario, for instance, it comes back to the fact that because we, like I said, parents are busy nowadays. Like no one has the time. So once they use the cup, they don't clean it well, and
better frame
or say one way, then they just cover it. Obviously ants are attracted to sweet things, so come
people have experience in their house.
So unless you change the actions you are doing, you keep on seeing the same like reactions always. So the best thing to do, make sure that you wash the cup that you give, or the plunger, then or the syringe, whichever one you are using. Then after that, make sure you use a warm, a moist tissue to wipe the bottle. Like once you are closed, wipe it, because if the ants come and they can't taste sugar, they will definitely not be around. So you keep it well, and you won't have the ants. The ants coming doesn't mean the medication is spoiled, but rather because you are not keeping
it well.
Yes.
And sometimes if you are not careful, some of the ants may end up
entering
the medicine.
Yes.
So someone says that like her mother used to tie their medications in rubber, and she wants to know whether that is also safe. Like now, syrup ni now rubber, black rubber.
No more
baby. Because she said they used to write keep in a dark, cool place. Rubber in the dark. No?
Yes.
So putting it in a black poly, okay.
So, I think usually it comes back to the heat and the moisture. If you tie it in a black rubber and then it generates some level of heat or moisture around the medication, then it's not appropriate.
Okay.
It's not appropriate.
All right. So we'll come back in a bit, and then we'll talk about what to do when you take medication and then you experience something that you're not supposed to experience. Right now, let me talk to you about Best Brain Publication, which is the leading publication company here in Ghana, and they have lots of books on the markets that are approved by NCCA and are 5-star or A1 rated. Books go at the heart of your school, so go for quality books from Best Brain Publication. They have books for preschool, that is creche, nursery, and KG. They have books for basic 1 to 6, that's for math, science, English, computing, creative art, history, religious and moral education, French, Asante Tree, Ekuapim Tree, Ga, and Fanti. They also have GHS books for basic 7, 8, and 9 combined. That's for maths, integrated science, English language, career, technology, creative arts, social studies, religious and moral education, and French. And then they also have books for SHS, for general science, general arts, business, home economics, and visual arts. Their head office is located here in Kumasi at Pankrono behind La Posada Hotel. You can call them on 0507 200 200 or 0241 520 946. They also have offices in Accra at Ashiye Fulani Road, Amber Street. They are also in Tamale at Bayami Islamic School Road. In Takoradi, they are at Asake, adjacent the Scan Center. And then in Ho, they are at Barracks Newtown, Penwa Road. In Sunyani, they are at Abisim, behind the Catholic Secretariat. In Koforidua, which is a new brand, they are at Nyami Krum, close to Nana Owari MA School. And in Sefiro, so they are also close to the Beulah Gardens. You can also get copies of books from Best Brain Publications from all leading bookstores. Ladies, if you're experiencing irregular periods, painful menstruation, cramps, PCOS, ovarian cysts, mood swings, or fertility challenges, Offcyst is here to support your reproductive health. Offcyst helps improve ovulation and egg quality to enhance fertility. It regulates menstrual cycles, relieves period pains and cramps, balances female hormones, boosts libido, and provides support for women managing PCOS and ovarian cysts. Take a step towards hormonal balance and overall well-being with OFCYST. It's available at retail and hotel pharmacies and chemical shops near you at a very affordable price. You can contact MedPoint Pharmacy on 059-660-7858 or 050-021-0133. You can also WhatsApp them on 059-660-7858. OFCYST, helping women achieve better reproductive health. And you're on the Health Lounge. My name is Dr. Jim. I'm here on your radio every Saturday from 8 a.m. to 10 a.m. And today we're talking medication safety. And like I always say, we spend a lot of the time saying the real things, the things that you're experiencing at home, the things that you don't want to tell anybody, the things that you are hiding. Those are things that we talk about here on the show. And we always have experts here. Today my guests are PHARM Dr. BENEDICT AGYENIM-BOATENG and Dr. Mrs. WYNETTE KOFUA ODEI NYARKO. Her name is complicated, so I'll take it like that. She's also a pharmacist at Confirmatory Teaching Hospital. So WYNETTE and Ben, so now I've given the medication. Suddenly, the person is behaving funny. Is it that a donor say, and I say I didn't give you well? You know, or you just have a children. Someone is asking that when they say we should give 5 meals and she mistakenly gives 10 meals at a go, can she skip the next dose of the child? Or so or she has done it already. Okay. She was supposed to give 5 meals. She didn't check the plunger. No,
1
more 10. This year, no. Or best skip it and you made an say, oh, my God, needs to be brain.
So I think it would depend on the type of medication.
Okay.
Yeah, usually if it is para or maybe those painkillers, I think there will be no significant concern. But even for the antibiotics too. But provided that the next medication, the next dose is that distant from the initial dose, I think the patient can still give the next dose and then give the accurate dose this time. Yes,
okay.
so.
All right. Good morning to you, Gentle, from UGC. He's saying that sometimes when you go to the pharmacy, they give you different medications but the same function, saying that this is American made or Ghana made, and one is cheaper. One is cheaper than the other. Usually the cheaper one is a Ghana made one, and he wants to know whether it's good for our health. So why not? And sometimes you give options.
Yeah.
Right.
Yeah.
And therefore, but the one can say it.
Oh yes. Oh yes.
Oh yeah.
Oh, say it do on my food. It do on my 4 CD.
But it works.
None down for your bay 400 CD.
Yes.
Doesn't matter.
Yes.
And found that
they be cry and they be cry.
It doesn't matter. Cry.
Like Anna is true. So we say a drone.
We
say I am also say Papa, we're 10 CD, we're 100 CD, we're 4. Now so now you see they are checking your pocket.
Yeah.
So it's all good. It's just like based on your pocket.
Yeah,
exactly.
Not even the reason why sometimes there are variations in the and the prices are because of, like he said, some are Ghanaian made, some are made from other countries. And based on the fact the cost involved even in bringing them to Ghana can make it more expensive than the other, but it doesn't mean it's better than the cheaper one.
Okay.
So we just and some people feel more confident taking medication from certain countries. So we try to let them know, oh, this is from here, this is from here. Then you make the choice based on your own preference. But it's not a matter of one being more efficacious than the other. Yeah.
Okay. Then now,
I think to add to what she said, there we have generics and we have innovator or brand.
And the momo bro for NTS.
So let me break it down. The innovator or brand are usually those people that are, I mean, the discoverers, those that discovered.
So like they invented their drug.
Yes.
Okay.
Yeah.
Yes. So they did a lot of clinical trials, and a lot of money goes into that, and advertising, promotion, and all of that. So usually those ones are expensive. And then after a particular period of time, they lose their patency. So then other companies are able to manufacture that same drug. So those ones are the generics.
Okay.
But usually they are all subjected to regulatory standards as far as the safety and then the quality are concerned. So when it comes to efficacy, they are all good. It's just a matter of, I mean, this is a brand, this is a generic, and then this is the innovator. Yeah.
Hey, pharmacy 4. Anyway, so like someone asked earlier, so she has given the medication like to the child, she has kept it at the right place and everything, but she has given the medication to the child, and suddenly like the child is behaving like abnormally.
Yeah.
When that happens, what should you do? Like again, I want you. Why slow and I say, you know, like baby, or as a confused. When that happens, what should people do? Even for adults, you take the medication, suddenly, like you are off. When that happens, isn't the medication was not safe? I have not taken it correctly.
Okay, so with medications, like I said, individual systems come into play
Orange,
here.
107.9.
Some people may be allergic to some medications, especially children. They are now growing, so you may not know all their allergies or allergens in this case. So let's say you give the child medication with penicillin inside, and they get a penicillin reaction. You may not know first, but first and foremost, let's talk about the general reaction. You give a child a medication and you see a reaction different from the child's normal behavior. I would recommend that first and foremost, do not panic. Observe like for 5 minutes to 10 minutes and see. If the child is getting unconscious, I recommend you rush the child to the nearest hospital or nearest healthcare center so that they can attend to the child. When you are going, make sure you take the medication in question alongside. Know the name of the medication, know the dose you gave, know the time you even gave, so that they'll know the interval between the medication when it was given and the reaction that they saw, so that the best help can be offered. But some reactions are mild and some are very intense. So if you give it to the child and realize they are acting some way, you can just walk into a pharmacy and like, oh, the child seemed to be off after I gave the medication. There's the medication I gave. Then they can see the problem and attend to it. So that's what I recommend when you give them.
Okay.
And I also think that it's not always the case that is associated with the medication.
Yeah.
It could be that the condition is probably getting
worse. Like something is happening.
Something else is happening, and that we need to do further investigations and see the way forward. And I think one thing that I would want every listener to take away, this is something that we don't usually do, that we keep records of our medicines.
Records?
Yes.
Our records, you're saying?
So like if you are prescribed the medication, or you got an over-the-counter medication, or you got a supplement, or probably this was a herbal medicine that somebody recommended for you. Ideally, it's best if you cannot write, at least take a photo of that medication, just for record's sake. Should in case an incident happens, or you admitted at the hospital, we call something medication reconciliation. We're able to know your past history, your drug history,
the medication that you are taking.
Yes, exactly. And we can trace if it could potentially affect your current medication, or it has anything to do with your current condition. So it is important that I think every Ghanaian should do when you walk to the pharmacy, whether it's a prescription over-the-counter medicine, the dose that you're expected to take, you can take a picture. You can have a picture of the drug itself, and then you can have a picture of your supplement and other things, just for records sake.
Just for records keeping.
Yes. If you can write it, you can write it. And sometimes too, if you are aware of the indication for those medication, you can always ask your pharmacist. So I think that also helps with adherence. So this is a BP medication supposed to help lower your BP. So you can have a sheet or something and write the name of the medication, the strength or the dose, and this is for my hypertension. Maybe this is to lower my cholesterol. You have the name of the medication, the dose, and maybe the indication. You are also informed about that. And it helps with adherence, and it also helps with medication.
Sometimes the older people, they will tear a portion of the drug, and then they'll come and show it to you and say, oh,
this is the medication.
Yeah, like a durinamidazole.
Yeah.
All right. Let me circle back, and then we'll continue the conversation. Okay.
Kumasi business owners, it's time to level up. The Ghana National Chamber of Commerce and Industry presents the Chamber SME Business Forum and Exhibitions. 3 days of connections, learning, and networking and business opportunities. Whether you're an SME, startup, trader, manufacturer, or entrepreneur, this is where your next opportunity could begin. Supported by Ghana Enterprises Agency, Republic Bank, and GCB Bank. Join us Wednesday 26th to Friday 28th August at the Kumasi City Mall, Asokwa. Showcase, connect, learn, grow. For registration, call 024-472-7221 or 020-435-8242 or 055-338-4376 or 020-435-5221. Chamber SME Business Forum and Exhibitions. Your business deserves a bigger room. Come and occupy it.
And we're back on 107.9 Orange FM. This is the Health Lounge. My name is Dr. Kwesi Jima. Your texts are welcome on 059 0593 932 993 0593 932 993. So I have two questions for you guys around the same thing. Someone is saying that if I give medication to my child and she vomits immediately, is it advisable to give the same dose afterwards?
Yeah.
Very, very important.
But not right afterwards, because if the child vomited, usually in something, I'll recommend you let your pharmacist know. Maybe we can give metoclopramide or any antiemetic
or something to stop the child
to stop
from
the vomiting. Because if you give the medication again, the child will definitely vomit.
Okay.
But with the dose, you still have to give it again because they brought it out.
Okay.
Yeah.
And then there's another question of vomiting where the person is saying that, like, I have given the tablet. The child has vomited after 10-15 minutes. But me vomits nima enim. So it's a doing call. And they don't call it.
I just saw it dissolve.
Yeah. It hasn't absorbed yet.
Yeah.
So usually medications take a particular period of time before it gets absorbed. Dissolution within 10 to 15 minutes, it will dissolve, but it's still in your GI. It hasn't.
So it hasn't been absorbed yet.
So usually it's best that we give a
again.
repeat of the dose. Yeah.
Good morning to you, Kweku Finn. Kweku Finn is saying that his mother's medications, sometimes he realizes that, or say, pills. And sometimes he realizes that the medications break easily. And he's wondering whether it is how he's keeping it. And when they break easily, they dissolve it on a spoon for her to take. He wants to know whether they are doing the right thing because wasn't it beeping and muffle? Finn, so that's your question. Because the way he has to take, he said like the medication breaks easily, and sometimes we need to mix it in a spoon before we can give it to her. But her blood pressure is not getting better. He says, is that medication still safe? Is that medication still working? So
I think I have two concerns here. The first one is why are they breaking it? Like, is it per their own like intention or like they were it was recommended they do so, because some of the medications they are quoted, or some of the medication have long action, like in the sense that when you take it, modified release, when you take it, it's not supposed to work right now, so they make it in such a way that it will travel through your mouth, through your stomach, so it gets to the place it's supposed to work. Then it has to dissolve. But if you make it dissolve before then, you may not get the right effect or the intended effect. So that may be the reason why they are not seeing reduction in the BP. So I'd recommend they go and see the pharmacist or their healthcare professional. And the fact that the medication is breaking easily, like it's a concern, because if it's in a tablet form, it's not supposed to be brittle, that it will be breaking easily. So they should.
But let me ask the two of you: is it every medication that you can grind and also beating me?
No.
Sir.
Yes, there are specific medication that the caution is do not crash.
I'm giving it like me nana. I didn't mean a bit dear 1 hour or more. Makes me pentem.
So some medications. No, it's not advisable. I mean, some of them you can just simply dissolve in water, and then you administer if the patient is having swallowing difficulty.
Okay.
Yes. Okay. And there are some medications that are available in what do you call it?
Solution
form already. That you can just give the alternative. So if the patient is having swallowing difficulty, instead of going for the tablet, we would settle for the solution form. Yes.
Okay. Jessica is asking that. Ask your guest for me whether taking medicine with hot beverage, cocoa, tea, is safe.
Not at all. I think if she's been following with everything we've been saying so far, in as much as storing the drug in the right place matters, some temperatures also affect drugs. So the cocoa is very hot. The tea is piping hot. Please, once you take it, yes, but and also because at the end of the day, no, maybe person hotel, but cocoa no de become, but I say a journal until you the right benefits. So a joe dear, anything hot, keep it away. We wouldn't recommend you. No more with chef for
because it don't end, you know. It is so it's not safe.
No,
it's not safe.
So listeners, you see, all those who are sending me all those who are sending the banco and the full text messages. It's not safe. It's not. What about banana?
No.
Why you put the medicine inside banana?
Because of the taste skills.
People are doing things, so please. Wow. The pharmacists say that the medicine is not supposed to go in like maybe a warm beverage, say be a cocoa, tea, coffee, Fanta.
I mean, there are some medications that we can add. We can recommend you add to some smoothies, like collagen supplements, the supplement base, creatine, those powder. We can ask you to add them to some smoothies. But then again, with those long-term medication like that people are on, hardly would we recommend that you add food or you put it in hot water or drink it with hot beverages. No, not at all. So if you are confused, please just ask your pharmacist.
Also, the cocoa
but
yes, the concern is the temperature.
The temperature, yes.
I mean, you can take medication with some foods, even milk, what do you call it, some juices, fruit juices, and all of that. But usually, if it's hot, if it's a hot beverage or a hot meal, then it's not really.
So somebody is saying that he takes metronidazole with hot water for quick action.
Hey,
people are doing things
for quick action, and he's asking whether it is good. Please, it's not good.
It's not good. It's not good.
It's not good. So who say warm water into or say like for stomach upset into a quack or
I don't know why Ghanaians have that mentality. Like anything tummy upset, they think that a crow. So then hot pepper soup will work, maybe antibiotics, metro will work.
So all those things, no, like also beside pharmacy, like also
you can always reach out to the pharmacist.
Okay.
Pharmacist is the most accessible healthcare professional.
Rather,
yes.
Everywhere. I mean, you just walk in and you just right now. Right now, sweet sisters here say, if not for the fact you are here, or problem and answer where pharmacy or here, no.
All right. So the narcosis is saying that if you were given a capsule or tablet medication to taking within a specific period, and when you were taking it out from the blister, one fell to the ground. Is it safe to wipe it with tissue and swallow?
Oh, sweet sister.
Oh, nasa tough.
There be. We in your 5 second rule. No, I say.
Edwene boy din.
Edwene boy din, but wapom ho din ehu hia che.
Edwene yen sape on so e be 400 cedis.
Wapom ho din ehu hia che.
Say me find my.
But form you never know that people stepping there.
Me and be stepping home.
Hey, please no. It's better to err on the side of caution, like on the side of caution. I mean, if your own home and you are keeping it neat and a wow feel names all people come out of form and get bad please, but say me now quite want in a major out of from no afar, that wouldn't be the best.
And a hospital
like yeah, we go ho person who turns so as I compare area for us account.
Well, she says that for her, no matter how clean the floor is, she should throw it away.
Simple.
But I didn't say do to for my infants and no.
In this under normal circumstances, wouldn't recommend you do so.
Scarcity mindset.
I'm still reading your WhatsApp messages on 0593932993. Someone is saying that or say na name mami edru egu polybag egu rabem. Into obisa say ino na waka nyina abom no pressure edru diabetes edru ne to ase hihye edru nyina na waka egu rubber ba akum no. Or see a year and I compare different containers. No fengugum.
I think sorting it out is best because a frafrasana, some of them the package can fade, and then some of the medications are also very similar because they are all in a film coated blister, and as and when our OEE medications. I remember I did medication on it for a patient's polybagging.
Yeah.
And she was taking paracetamol instead of metformin.
It's not good.
Can you imagine?
In the party they were finding now. Metformin. So if and you see sometimes it's like so when they come to hospital, we put you you put the medication all in one bag.
Yeah.
Into they be answer or quite or the rubber share rubber fufu
From
into also separating
yeah.
Also separating hypertension then from diabetes then from
yes. So it comes back to the recommendation I made about keeping a record of
your medication.
So once you know the indication, you are able to sort them out accordingly.
And even aside that, once they come to the hospital pharmacies, let's say we give you a blister of metronidazole, we keep it in that rubber envelope. So don't go home and take it out. Oh, make I say joining, because if it's in the rubber envelope, you know that metronidazole, because you write it boldly on it, so that it will help you differentiate between your medications at least.
So please, listeners, the pharmacists are saying that. One, when you come, don't be in a rush. They have time.
Yes.
So take your time and let them talk to you about it. Men can say don't. They be a father dada. No, sorry, now go. You understand? So take your time and then let them help you with the medication. We're talking about medication safety. So when people go with, let's say, elderly people to the hospital, someone wants to know that who should we give the instruction to? Is it the elderly person or the person who came with the elderly person? Is it because I fight with my grandmother every time we go to the hospital? Because he says that what I'm saying is not what
the pharmacist okay.
So like how should that conversation go? Like who should we give the information to?
The caregiver
the
and the person too.
Yes,
I mean, for some geriatric patients, they may not understand what you are saying, but at least but you make sure you emphasize the point to the caregiver too, so that at least both of them will be on the same frequency of understanding. So
sometimes the person who accompanies the old lady to the hospital is not the person who is directly living with the patient or taking care. So then whoever is in charge or whoever the caregiver is, it's important that they communicate or they relay that information. And then sometimes what helps is we expect that they would reiterate every information we've shared with them concerning how to take the medications, so that we are convinced that they actually understood everything that was communicated.
Someone wants to know that the medication dosing, say our dosing was written on a box. Then we lost the box. Saying that we went back to the pharmacy and the person there did not know what the previous dosing was, because it was a private pharmacy and they don't keep that record. So can you ask your pharmacist that at the community pharmacy, how are they supposed to keep their records? Because it's not like you are prescribing on an AMR. The person just walked in and saying that like those don't throw boxes, the box naira. And then they've gone back and the person there now says this is how many day.
You see, earlier I mentioned about records.
Record keeping,
You have a prescription. If it was a prescription medication, ideally you can put a picture of the prescription. But you can also have a copy.
Okay.
You can always have a copy. Yes, ideally. This is because some medications, patients will end up
going to buy again.
Especially those opioid medications and all of that.
Okay.
So the prescription was for maybe 14 days or 30 days. And yes, they are dispensing now. If you still have the prescription, you can go back and get it again, because probably it's not because you want to use to manage the pain, but because you are getting addicted and all of that. So it's very important that we keep
the prescription.
Not at all. Even aside the opioids, I have one particular client or patient who came back to our place and she was like, I'm buying Zithromax again. I'm like, Patch, add anything I auto Zithromax. And she was like, said Dr. Nedemato. And I was so confused. So the first time she bought it from, the first time she was given it at her hospital, she took it. A sign on the box, another place. And in as much as we have pharmacists doing well, working well, we have shabby places too that are selling these medications or questions so we try to, at least if the prescription, we keep it there. Number if it's a repeated, it will definitely give it back.
But some people are doing very well. I think I walked into a pharmacy and I said I wanted some diazepam because I couldn't sleep. And lady was like, you need to have a prescription. I was like, sister, Debbie. I said, madam, I don't know. I got a prescription. I travel. I said, and
yes.
So I was like, Charlie, people are doing the work. Then I went to drink milk and I went to try to sleep. Somebody, Kodak 1000 is asking on YouTube that what about taking medications with cold water or cold drinks, and also taking medication with cold water or cold drink. I think a lot of the things with medicines are like obia developing way or fair drone. Even though you guys have said drink it with water, I said everybody wants to do their own thing. So cold water or cold drinks, and also
the cold, it depends on the temperature now. I mean, this is cold, but then it's not that extreme cold.
Okay.
I genuinely doubt the type of cold water we drink here will be so intense to affect.
Chill though, their blog will move.
But also, their own team ice block with the to an extent. We wouldn't recommend you drink with cold, but I mean, as I'm saying, I doubt that temperature normal fan is like substantial to affect the efficacy of the medication.
And it actually affects how the medicines are dissolved and absorbed.
Okay.
Yes.
Good morning to you, Boy. Boy is saying that please ask your guest that should all medications be chewed. He said, I am fond of chewing my medication.
And
I have a problem.
para, especially
like,
para.
I know someone that chews para. Like, and personally, even though I'm a pharmacist, I don't like taking medication. Like, so when I see people like capsule or berry, para or berry, like any medication, I don't know if it's an addiction at this point.
No, or say all the medication that he's giving, like also
I mean, once you chew it works faster.
It's not supposed to be so. It's not supposed to be so. There's a reason why medications come in the way that they come. I mean, there are some medications like area release faster, but most medications come the way that they are because we want it to release over certain times, not instantaneously. So yes, now and then the last day on life behind now on swallow when it's required that he swallows and chew when it's required that he chews.
And usually most medications according to standards. I mean, once you take, especially for tablets and even capsules, they will dissolve within a period of like 5 to 15 minutes.
Yes.
So you don't necessarily have to chew so that the medication will work faster on it.
Okay, I have an anonymous texter who's anonymous to all of us, but she's saying that one of her challenges with prescribing medications to patients is that when it comes to purseries, women always find it very difficult to store it properly, and they'll come back and tell you that the medication is not melting. So kindly ask your pharmacist to educate people about how to care for vaginal purseries, where they should be kept, and when they should be used. In common, it's critical.
Yeah.
Because usually when you're giving it to the people, they are shy.
They don't have time to listen to your instructions.
If you're like a Benedict or Ferry Benedict, she's looking down and into ontie. So medications that women insert, first of all, where should they store it? And then she says when they wake up, sometimes the medication falls out, but they won't come and tell you say do not offer. And at time men or fan share.
I think even with the pastries, even aside pastries, suppositories, we have some that we keep in the fridge. And we have some that we don't keep in the fridge. So when you come to the pharmacy, for instance, some pastries, we keep them like cool temperature, at a cool, dry place. So when you get it, just because it's hard or you think it's a pastry, does not mean go and put it in the fridge. Don't put it in the fridge. So you can just keep it at a cool place. And a dry place. It makes like the drug melt normally. But if you go and put it in the freezer, already it has frozen. The consistency has changed. So it may take a long time to melt and you may not see the intended like effect. So recommend just honestly, I want to give a disclaimer, please. When you come to the pharmacy, the reason why we wake up every day, dress, come and sit there is because of you.
Yeah, very more.
Very in this is because right now say Benedict now question now your ban now become was matrona. I doubt Benedict who want to for Becca say issue in unless you yourself come and approach. And we also have patients pharmacist confidentiality. We would never go out and mention your case. So this is the pharmacy is the best place to feel free. When you come, just feel free, talk to your pharmacist, because it's best to leave with knowledge on what to do, how to do it, rather than to leave with a lot of doubts and you go home, hey, no, it's me fan sharing. Because we've had an instance where a patient came, John ma fasa me dia me na somewhere. Patch somewhere saying, like I was so confused. only to find out that it was a suppository.
And she's swallowing
And it was an old lady too, so it was so funny. She was like, I was like, Mommy, Pacha also then, because I had to like mention, ask her if there were other medications that she was also taking. So there be yes bullets, no. Me and Nasa could she me. I was like, Mommy, Pacha, not Okoin Diana Catro or pharmacy honum. I was like, maybe nobody could be also me faint here. So it turned out the tablet she was inserting and the suppository she was swallowing. So imagine if she had exercise patience, like it would take you like 10 minutes.
No, but sometimes you see, let me play the devil's advocate. Sometimes you see, you're very
advocate of the people.
Yeah. Like when you say a line you do so, the pharmacy. Like fine girl be the match. Means so.
Did you find girl?
Like means so no. A donor more cano. Let me baby kame. Me pesa fine girl. In the moon is our home. Like I am in free lining.
I think
baby.
Usually a lot of pharmacies have counseling areas.
Yes.
So if you want that, you can insist that
you can tell the baby. That's a ferry.
Feel free and tell them, because I think once you tell your pharmacist that train, then they'll attend to the people. Once then they'll attend to you, and time by that time now crash no so
that's a crash no pharmacy so
that's for go to a different pharmacy.
And then I'm crash no 0541022318. That's the number to call. Is the health line. Listen, we're relaying your concerns in real time. We want you to feel free when you go to the pharmacy. Like my pharmacists are saying, Charlie, you when in like my mao my cancer and chewan kasankasa. Unim say Adena Mokacho no. Unim say wunti. Unim say when in the hole. Into a I am moment in the hole. All right, let me pick this call coming in. Hello, good morning.
Yeah. Hello, good morning.
Yes, sir. Can you go ahead?
Sir. Yeah. Mbasa mekafi.
Bacho kachi.
Maya de mu. No mami no. Say no more table for no kind of my every issues.
And okay, internet edition but from Fafrano.
But Chinusa. Assassin market. Near the Tosun Bill. My Pamacho. I am here a I had a number of them evaluation consensus of IR reform. I think you who said the Editiana, nominal the Editiana, Nakaya, and say images be Buakaka until now. Ya package envelopes in the idea room with Gumni who said, to say, in drone be a say, I am in your fat one. Until the South of Samoa, no one who said a drew way, Newton, son of the survey and unity. I refu been so bad, I say, near ye be war and character, so now the idea grew no now upward. And then the answer, and Yamin Shamo with my family.
Sapepe, Yamin Shao, so thank you very much for your call. I think he makes a very fair point.
Yeah, very
I think he makes a fair point. I think that I was say, in KOFUA pharmacy, yeah, more show and tell. Say a drone no ebia suppository no a package mu say ye be say because I witnessed the mom who pushed the whole suppository with the pack rectally.
Wow.
Say I catch and say Jennifer Kuchiano. Yan can channel say on tit. Aha, inti no so ho inti na ahye no so. Hello, good morning. Hello, good morning. Hello, good morning.
Good morning, sir.
Yes, sir.
Yo, with it, my don't say. Na, the person me can say. No can be say. No. You will be on one. I will. Nebo no so be free brutally, and a being so Ghana ha. Na, media may my experience be pay. She said, dear, Nebo no high no. ne efficacy no e wo so kakra sen de ne bo no form no if you say me da ayi so prostate enlargement so tamsulosin na first no na me koto ba ko no e wo ayi no British made no no na 70 cedis and now the any war form no 40 cedis na me check in me no said me use the any war no was no me Johnson be free e go straight kama na the dominant kana me kwa koto the any war no form no Johnson no week e ba na asimi trase e ba de na nso no na asimi trase enti ni difference wom enti no se uni sika woto e no ai bebo a ode na nso no ka wo sika de a woto de ne bo no wosoro no ane number one question say ya ne ya bi before one say negligence no doso say ya aduro no aye di maye no mo anopa awia na time no aye di benno no se bia mi kura say ma try me that I pressure dose ma try say ka no pa bia me no best 8 o'clock enso no ona mi refi bi kura 12 no ma kofa no ma no e ki time no adi no aduro no accurate time aye shema aduro no any tie no no time bia no ebuaye ne ana immediate ne boa ebuaye
Medase pa. Thank you so much for your call. Okay, we'll come back in a minute and pick more phone calls and then also answer your questions after this short commercial break.
I pledge to drive safely. I will obey the speed limits. I will never drink and drive. I will not use my phone while driving. I will wear my seatbelt and ensure my passengers do the same. I will be patient, alert, and considerate on the road. I will not overtake recklessly. I will respect pedestrians, cyclists, and other road users. I know one careless decision can change a life. So today, I choose safety. I choose responsibility. I choose to get home alive. I am a responsible road user. I drive safe. This pledge is brought to you by 3 Media Network across our units. In Kumasi, Orange 107.9. In Accra, Plus 89.9. And on TV, 3 Music TV.
Rodri walking forward, plays it to Kovacic. Kovacic in the final third. On it goes to Foden. Foden wide to the right to Walker. Walker goes back to Akanji. City appear to have got control of this match again after a 3 or 4 minute spell in which Burnley had a few good moments. Now down the right hand side, Walker crossing position. On it goes to Alvarez near the penalty spot. Haaland hits the back of the net. Can you believe it? Of course you can believe it.
The Premier League is back and we are here for it. Build your dream team and battle it out in the Orange 107.9 Fantasy Premier League. Join the official Orange 107.9 League with code CFKUJX. CFKUJX. And there is more. Top managers every month win exciting prizes. Finish in the top 4 at the end of the season and you get rewarded. And for the ultimate champion, the overall winner takes home the grand prize. So pick your players, make your transfers and climb the table. Orange 107.9 Fantasy Premier League. Are you ready to be the boss? Join now. Code CFKUJX. Again, CFKUJX. Terms and conditions do apply.
Saturday, 29th of August, Golden Bean Hotel Dome, McBrown Productions, and a coffee buy. I'm being going to make Saturday, 29th August, you're beginning Prenu, 4 p.m. and 8 p.m. Sukuni bet you 100 cents. Oya Ankonama, 150 cents. Samona Benua, 250 cents. So, ticket at star 714, star 39 hash. Dial in Cecilia, Nejo take it, Neshia. Abraya Premier Senior, Biaka wants them.
My show. I propose the new baby. Make to me, we have a promise.
And Crawford Sicano, and now the Quakutra. Now you do well. Tell me about him. This is what I really want break up here.
Me say, I could grab your miani bushing, me qua, also from in push it diago.
Doctor like you running you. Nana Chibu, huh? Gana senior fan into my pefra. Brabejo when you swadi.
All right, and welcome back to 107.9 Orange FM. This is the Orange Health Lounge, and my name is Dr. Jim. I'm here with Dr. BENEDICT AGYENIM-BOATENG and Dr. Mrs. WYNETTE KOFUA or say NYARKO. Let me tell you about Perfect Skin and Body Therapy. If you're looking for professional solutions to your skin and body concerns, you're worried about scars, stretch marks, acne, and dark spots, Perfect Skin and Body Therapy is the place for you. At Perfect Skin, your skin goals meet professional aesthetic care, from scar and stretch mark treatments to acne and dark spot care, tattoo removal, earlobe corrections, and selected body contouring and enhancement treatments. Perfect Skin and Body Therapy offers you a wide range of aesthetic services designed around your needs. Whether you're in Kumasi, Accra, Takoradi, Perfect Skin is closer than you think. In Kumasi, they're at Busheng Abraham Junction. In Accra, they're at Osu near the Akwaje Park. And in Takoradi, they're at Kitten Junction. You can call them on 055 33 12911 055 3312911. Perfect Skin, because skincare is self-love. Visit Perfect Skin today and speak with qualified professionals about the treatment that is right for you. Perfect Skin and Body Therapy, your body, your confidence. And we're back on the show. We just have about 20 minutes to go, and we've been talking about medication safety today. And who would have thought that a lot of you have so many concerns about the medications that you're taking, about the medications that you have been given. And like we're blending the English and the Chi. And the question has come in from a guest. So let's answer the questions from the phone call. So the gentleman who called about the cost of the drug and the quality, or said don't know if you UK or no man Johnson go straight. I don't know if you Ghana no man Johnson is in the TS.
So what I would say about that is, so no grano way is to see Nkechi or
Nkechi mesewa.
Enti who say me shasi no me chiu mu say enso so ye bia nheda enimu sa. Me my honest opinion, I think say the mindset no. Because of the bioequivalent, say it was say a drone the original or innovator brand on other generics no, I would say a year similar in terms of efficacy ne certain a year or mushe. Inti once a year FDA approved that ya ye hwehwe mu say ye dwuma de a ye dwuma. Inti ni nyina agina wa ho oden so. And sometimes mindsets no it actually trim to say e ya brofu dronko ade e ye. I know minim a scenario my friend be or the couple man ba M1 no be sa but omano local ones top brand no things say 5 cities
it's true.
I think say a mindset,
and sometimes I think I prescribed a cough mixture for a cough suppressant for someone, and when she got to the pharmacy she called me and she said, is the medication supposed to be 15 cedis? And I said yes, it's made in Ghana. She said no. I said this is the cough suppressant that I trust, and I know it works, so buy that one. She was not too convinced, but she bought it anyway. After 2 days, she was like, hey, 15 cedis, but more power, because she had bought a really expensive one. But how much for your bound? And as a Kenyan house, your dresses are kicking. Your dresses are Kenyan house.
With the man's issue, sometimes I think placebo effect is say Obi so catching so near 1,000 cedis. Now maybe my man orange juice, I'm catching some orange juice near 500 cedis, but maybe Nina be more tea or yakwa or benum orange juice, but because I can say price no form ninety. on you're so convinced about it, but when no I catch say, oh, meeting me and so probably because when you say about Kofua Broche, na bako boy day, na bako boy ye day see, it makes him think the other one is working more. But
sometimes you will do beer like and the board him, but as on me, I know who infecting. It do be a horse. Sometimes it do be a horse, and oh, ye 500 cities now what talk, but
it's worth it.
As soon as I no more say, wait, I say
changes for.
I say changes from kakra, but I didn't say it don't need an active ingredient in the womb. Sometimes I'm mama my in the price nechi dodo. All right, so someone is asking that now when it comes to disposing of medication at home, kindly ask your pharmacist for me. I am done with the drug and I want to dispose of it. How should I dispose of tablets? How should I dispose of leftover of my kids' medication? Let's come to that after I pick this call. Hello.
Hello.
Yes, sir.
I mean, me this you know, me buy. Now, me beside 2 questions. May I say, no, I say, young Africans, no, and I say, me quantum tisadia. Yani a buoy and nigu time, Doctor Rebecca send no manopa, no more via. Nemo no, time no, ye debed no more druno. Sebia, 7 when yes, you was having no pebia menum. 9 numerals of 4 no man no more. Yeah, time no a boy. Ye di time no so a boy and I say, ye ni time no so ye no any time. And also so and so ebene demo.
Yo, me that's it. I forgot. Thank you very much for your call. So the timing of the medication. Maybe yes, I mean 7. Talimania buffer so man the 12. I say more one.
I say more pa.
I say more.
I say more.
Oh.
Say me start here make asano. Na me chumu say medications be one of my time I was saying ebia yes 3 times a day. But 3 times a day no. Say like every 8 hours don't sharing what you be and was so no and a drubia benumbia a co mojemua a level be one of my was say jina a safe and cohaging but say ebia one time now was so no not time on everyone say and so you know one another dose account one it's me ma a drono do a wo mojen kosro I bet me so abro. Inti say kase nom ne 7 na no anom ne 7 na bia the second dose e bia ewia be 2 na 3 and also one e betimi a set alarm ne sa nyoma na aja aye yenkai ana say wo ne wo yire netia because me old boy ne me old girl abroa no kai nyoma inti ono de bia no prompt no say oh wo time aso no mo adro nti somebody can be an accountability partner na ono so
no so ne waka so say the fan say that they be me fan 7 but and then kwa dem we fin ma fan 3 o'clock
it happens and yeah, it happens and it should be once in a while and you say consistently
and they do ne ba e bia money en kasne be hu so okay e bia me anapa no the way am I shinum rebefi inti in can find like much mini makasa okay instead of an apano in kafane wia
I think say most pharmacies do it. I think if you be boil back to say obenya butcher oba pharmacy yes cause anti-malarial drugs say maybe obi ba no offer ye busan say na time ben na obedu fie nye ye busan okay medu fie time we okay into time ben na obeda like at that time now because sometimes you check and sure the next dose na ko we are much 3 a.m. So we him say at 3 a.m. oh sorry. So we check the time and sometimes we write on it maybe for way 7 a.m. for way 7 p.m. and after way maybe 7 a.m. na ko for back way maybe 3 p.m. and I say and I say maybe o man obo school time because parents especially because me the question we are sure ni teacher be and I say be senti you been in such a way time will be free school aba at least how bit me man and no pansa no be school did you na dey man you say breakfast your time but on me the man is 6:30 man journey be 12 hours from now maybe 6:30 p.m. by that time no we dear January we wo fie then so man so we try to make sure
we balance it. Let me let me say something that a very senior nurse has sent. No, also with the health workers for Bonnie. She's saying that tell your guests to educate health workers that we do not give injections at home. Pacho, you are pani ofie.
No.
Me mama a nurse. Me a pharmacist.
No.
Me
a doctor.
Me a doctor. Nti ye hweno e wo fie.
Me are meeting the one.
Is it advisable?
No, it's not advisable. I mean, complications can always happen. And then in the home setting, you don't have the resources to be able to curtail that complication. So it's usually advisable that those are reserved in the hospital. And in fact,
not even the pharmacy.
No, not even the pharmacy.
Okay.
I think it's nowadays that some vaccination protocols are happening that we are training pharmacists to even inject. But under normal circumstances, we don't give injections in the pharmacies.
So if you go to a pharmacy, some people do it. It's not.
But just some men can say. Akwara no e was saying it was oh me nurse oh me a pharmacist
some of the nurses even steal medications
and then go and give it in the house.
Oh,
so please allegedly please. So safety is more than just a journey safety, but even where you are giving the medication is really important. Nana Kosha is saying that can we talk to young ladies about, okay, I get it. So emergency contraceptives, she's saying that usually they come as 2 pills. And she wants to know whether it is safe to take those 2 pills at a go. Because you will be fee. Oh, then so and I make answer my obi bisa mostly. I don't know at I too. The Benedict and so echo see me with fear much. Inti meeting as a Benedict. The Benedict to assume the emergency contraceptives that are 2 tablets. She's asking that can you take the 2 at a go, or do you have to take it those 24 hours and 12 hours apart? No.
Yeah.
In Pacho.
I think you can take the 2 at a go.
Okay.
Yes, and if you think you want to space as well, you can space.
You can also space it. Okay.
Then usually most of them are also one tablet.
I think now most of them have tried to make sure that it's one
tablet. Yeah, that one is more.
I think it's the level 1 that usually comes as 2. But not cry. You're supposed to take it together most of the time. Yeah.
Okay.
But please, can I insert something? Since we are talking about emergency.
Insert something.
Pancho, my ladies, emergency contraceptive. Just say emergency. But of late, it looks like every day is an emergency.
Yeah, I'm planning.
But it was so planning. I mean, we have contraceptives that you can take every day.
Daily oral contraceptive.
Take those ones. But if you are taking them every day, it's an emergency. We have women that come to us and their hormones are way out of balance because of the medications they are taking. And Ober realize, me for emergency contract every week we are me Febby. So all of a sudden, when the menses, mass senior was say a day, so you have to make sure every day is not an emergency.
The recommendation is that every year you should consume just 2 tablets.
Every year. Oh, the amount for go.
The whole year.
Just 2 tablets. For like 6. So
yes, even more than that.
I mean, when I was in community, I had one lady who every Monday, every Monday was an
over the weekend, not just a Monday.
She was like, so I had to make sure I introduced her to the daily one. I'm sure saying. I'm just another pharmacy crap.
No, but I mean, like these are things that, like, you shouldn't take lightly. These are things that you should talk to your pharmacist about. If you're sexually active, if you are doing some of these things, you must know that they have side effects. Some of us have stood hours in theater fixing people's ovaries, and they're really, really young, simply because some of these things have terrible ovarian side effects. Someone is saying that the medications that are given for quote unquote manpower, can I take more than one? Because and So the medication that people give for sexual enhancement. Or say you find the back, but we say safe so be find say
so the manpower, the manpower.
Until be say it like said drone obetimi afan more than you can.
So a drobia ni the maximum dose utimi fan per day. And even like sometimes a drobi will high because you spread it out in a day. You say bro certain doses. So imagine say one you say for barco. Maybe in a day 2 penny was say utimi foul. No one could 2 not at once. Maybe a new person sa boy maybe 2 sa could 2. After what part the necessary dose, and we have people coming to the hospital sir. Our priapism because afe adena tia fasu age na so sa, and like one instance the lady couldn't come with the man, so the sister of the man had to come with him. So patrol, in as much as you want to perform, you don't want to over perform. So make sure say so person of abroad catch your pharmacist say bro the daily dose or be catch your so be catch your
say do na you wear was ofano.
And I want to chip this in. You know, drugs engage with receptors. In layman's understanding, no. Before say drobe ye juma no, you may be a war, everyone say be a drobe manpower. A drone back any you may be a war nipe be dear share and sanity me amount some manpower. The more who engage in a bedroom maybe no, sir at the end a drone etimidating who share money ye juma no. A be na ho de anase e be kofom. I said the charger and the phone. They be out the phone a different charger phone maybe drew baby no. Now
charging port na
I say. The bedroom maybe no a draw quantity and I said dose was a one no na ye juma no. Who side effects no.
But a branch be simi busa mo say edona mbrante ni chichiche no. And I say edona mbrante ni esprit no. Is safe na say you be using a sa.
Oh yeah, it's safe, but then you know to what extent? And I will use no. So to what extent? I know there are some ingredients we want to that medication is ma ebi awono. Wow. Ti udu spray na hwa na akofa asema ba. So know yourself.
But say don't so say me ba pharmacy, I see meet many pharmacists na kan. E number na sembe to WYNETTE and me can say.
Oh, don't be shy. Don't be shy. I'm there for you. Yes. Yes.
Yen can say me say na tie na.
Yes. Can say na now because like I said, it's better to leave with all the questions answered than to leave with doubts, because at least him say we na me you free in your mind, but now for me so you go and do the wrong things and you come back again to me.
Mark wants to find out that do some of these safety things we're talking about also apply to herbal medications?
Yes.
Like the way to keep them and all those things, no. I say herbal and so I apply and as more they different.
It does. It
applies.
Yes, it applies. And me, what I have a concern about with the herbal is especially you're more prepared with fear.
Herbal ni bo fear.
Concussions no mo ye fear no. No we share the book up ma.
Drew.
This is TikTok doctors not doors.
So
more share a clothes no one when no too much. It's not safe. It's not safe.
The truth of the matter is there's nothing wrong with herbal medications. I mean, and on India for it me are branding in such a way almost so verdict at the adina. I think Ghana we have regulatory bodies controlling all these herbal. It's better making sure say FDA approved it, because at least I know why dream when it's after the necessary process.
No, say like a papa.
And then also a first process me because say maybe for a chimney for back. But so we talking about because say yamwe far away from continue about way and your man a summer or barber connect no. When you now be here over the roof because you are not so sure. So it's best to make sure say to the FDA are regulating our
into say herbal medication and don't see your and your man yeah safe. Let me pick this last call and then we close the show. Hello, good morning.
Good morning. Please, I'm Gentle from Brema EGC.
Yes, can you go ahead, Gentle?
Please, I want to make an inquiry. How exactly can you confirm that maybe our local herbal medicine is FDA approved? What exactly do you have to watch out? Most of the time, if I just see a written number, someone can just forge a number, just write it on the medication. So, is there a specific shortcut maybe for you to detect that this drug is really approved by the FDA?
All right. Thank you very much. Good question. Is there a way to determine that this medication is FDA approved?
Yeah.
Besides the animal church, go home.
I think there was this issue at a point where FDA goes around, where some, quack people had infiltrated the system. FDA approved. But one thing FDA does is they go around and say pharmacy be a stock here, journal more approve, they'll take it out. So one thing I recommend is any pharmacy be a pharmacy. I think one mistake people outside think say, oh, me kwa over the counter across here a pharmacy. Okay. Maybe on one I born necessity ABC one or but as best say obeto a free pharmacy I wouldn't say like a year license to say pharmacy be wa should be a one now like an edin ajanim say nya adrobia no the besio and pharmacy stock these herbal medicines into drew ocean is at least in team say FDA shame or say sia and actual was so FDA approved on your social cry FDA hotlines. I don't have the hotlines, but I'm sure when you check their websites you can always call them and a draw in percemeto na more approve na so more approve ya crab bomb no ma akwache omo
FDA for some muti I even need you in the studio. I'm sure Lisa will make it work. We need to get FDA in there because sometimes people have those concerns because I don't know. Sometimes we box because the way they FDA approved. Oh, it's in a box no I'm one because the way when kwa the obishene dem no yeah. So
I want to chip this in. We have substandard drugs, falsified drugs, unlicensed and unregistered drugs.
Okay.
So usually the substandard the medication is below the quality standard that is expected. And usually the falsified ones, no, it's a misrepresentation completely. So a drone maka said when a womb, but it's probably adulterated or something. And then the unregistered and unlicensed, the medication is probably okay, it is registered by an FDA in another country,
but not in
Ghana, because they have not Ghana FDA has not evaluated the medication and has not approved that it is safe for the people of Ghana to consume. So that one too, we have to be very, very mindful about that. There is this common contraceptives that a lot of people, that women consume, which is unregistered in our country. But then it's cheap and it's readily available, and people just find a way of smuggling it into the country. So I think it's something that we also have to be aware of.
Then, it's 10 o'clock. Finally, before we go, someone wants me to ask you guys that the newbie beauty drugs and beauty gummies near the Obusa say is safe and was sending listing to mean to na or say a dorsum. Like every day somebody is selling some on Instagram or TikTok, and she's asking say ebema was skin a glow, ebema TV ebema we fire flat near the ebema also creams because on my so this rasa o so ebema tanya manyamano it is saying
I think we've reached a stage in life or in society where everyone is a healthcare professional. Because TikToker, people that have no license whatsoever, because they have the following, because they have the numbers, they any sikaka probing into or because advertise major way. They go on there and they advertise. But one thing I'll say is that you will not be able to know if they are approved or not, if they are good for you or not. But then, like I said, come to a reputable pharmacy. Or if it has to do with your skin, go and see a dermatologist. And we have certified clinics where a dermatologist is there. You speak to them, they'll give you the right medications. There's no way a dermatologist will give you a medication that wouldn't be approved by the right people. So it's best you make sure, if you have any doubt, just walk into any clinic, seek a dermatologist, ask them, or a pharmacy, make sure you ask them. Aside that too, I think one concern I had over the week, we found out there is this new intravenous medication where the ladies go and they do it weekly. It's all corny infused, your skin will be glowing. Then we're thinking about the effect on the kidneys, because skin but torso now kidney and torso there, then what are you trying to get? So I think there are a lot of trends, but in a trend beyond was say hopping on, see also be advertised here, draw sit back, ask yourself. Right now we're in a social media, go online, search it up. If you read and there are some disparities, just walk into your pharmacy, your clinic, speak to a healthcare professional and get the answers you